Before we begin, I want to make an important disclaimer. The information discussed in this presentation comes from publicly available sources, including news reports, public records, online research, and commentary. Throughout this program, you may hear opinions, analysis, theories, and speculation. Those should not be interpreted as established facts unless I specifically identify them as such. No individual discussed in this program is being accused of committing a crime. The purpose of this presentation is to examine publicly available information, discuss the timeline, and ask questions about an ongoing investigation. Everyone should conduct their own research and reach their own conclusions. And most importantly, every individual is presumed innocent unless and until proven guilty in a court of law. Hello, everyone. Welcome and thank you for listening to my presentation. In this presentation, we're going to take a closer look at the Lindsay Clancy case. We'll review the basic facts of the case, the charges against her, the defense and prosecution arguments, and the complicated history of psychiatric treatment and medications leading up to January 24, 2023. We're also going to spend some time discussing postpartum psychosis, what it is, what its symptoms can look like, and why it has become such an important issue in this case. My goal is not to tell you what conclusion to reach. Instead, we're going to look carefully at the information and ask the questions that a jury may ultimately have to consider. Let's begin with some basic background. Lindsay Clancy was a labor and delivery nurse living in Duxbury, Massachusetts. She is accused in the deaths of her 3 young children on January 24, 2023. Her daughter Cora was 5 years old, her son Dawson was 3, and her youngest child Callan was only 8 months old. Prosecutors alleged that the children were strangled with exercise bands inside the family home. After the children were found, Clancy also suffered serious injuries following an apparent suicide attempt. She survived, but was left paralyzed from the waist down. These events form the foundation of the criminal case now being presented in court. Lindsay faces multiple murder charges and related offenses in connection with the deaths of her children. She has entered a plea of not guilty by reason of insanity. The definition of not guilty by reason of insanity is a legal verdict, meaning that a person committed the criminal act, but because of a severe mental disease or defect at the time, the law does not hold them criminally responsible for it. It usually does not mean the defendant simply goes home. A person found NGRI may be committed to a secure psychiatric facility for treatment. Release generally requires evaluations and court proceedings demonstrating that the person meets the jurisdiction's requirements for release. That plea is extremely important because the central issue is not simply whether Clancy physically caused the deaths. A major question is whether she was legally criminally responsible for what she did at that moment. The defense argues that severe mental illness prevented her from understanding her actions in the way required for criminal responsibility. The prosecution disagrees. So, as we go through this presentation, keep that distinction in mind. This case presents 2 dramatically different interpretations of the same events. The defense argues that Lindsay Clancy was suffering from postpartum psychosis or another severe postpartum psychiatric condition. They contend that her mental health deteriorated and that the numerous psychiatric medications and treatment changes she experienced may have contributed to that deterioration. The defense maintains that she was not criminally responsible at the time. Prosecutors, however, argue that Clancy understood what she was doing. They contend that her actions were deliberate and organized. They have pointed to witness testimony, medical evidence, journal entries, and her behavior before and after the deaths as evidence that she remained aware of reality and understood her actions. Those competing interpretations will be critical. Before we examine the evidence in this particular case, it's helpful to understand postpartum psychosis. Postpartum psychosis is a rare but very serious psychiatric emergency that can occur after childbirth. It often develops suddenly. It causes a sudden loss of touch with reality, featuring extreme mood swings, hallucinations, delusions, and intense confusion. Although symptoms frequently appear in the first days or weeks following delivery, they can sometimes occur later. According to the medical information summarized in this presentation, postpartum psychosis affects approximately 1 to 2 women out of every 1,000 births. The exact cause isn't completely understood. Researchers believe it may involve several factors working together rather than one single cause. Most importantly, postpartum psychosis is very different from ordinary postpartum sadness, or what people sometimes refer to as the baby blues. Several factors have been associated with an increased risk of postpartum psychosis. One possible factor is the dramatic hormonal change that occurs after childbirth, when estrogen and progesterone levels fall rapidly. Genetics may also play a role. A family history involving bipolar disorder, schizophrenia, or postpartum psychosis may increase vulnerability. One of the strongest known associations is bipolar disorder. Some women experiencing postpartum psychosis already have bipolar disorder, while others may later receive that diagnosis. Severe sleep deprivation may also contribute. Researchers continue to examine the possible roles of brain chemistry, neurotransmitters, and changes in the immune system. Again, these are risk factors. Having one of these factors does not automatically mean that someone will develop postpartum psychosis. So, what can postpartum psychosis actually look like? Symptoms can vary significantly from one person to another. A person may become severely confused or disoriented and appear very different from their normal self. Delusions may occur. These are strongly held beliefs that aren't based in reality. Hallucinations are also possible, including hearing voices or seeing things that aren't actually present. Some individuals become extremely paranoid or suspicious. Others experience mania, which may include unusually high energy, racing thoughts, rapid speech, impulsive behavior, or an exaggerated sense of confidence or power. Severe agitation and restlessness can also occur. These symptoms can develop quickly, which is one reason postpartum psychosis is considered a psychiatric emergency. There are several additional symptoms that can be important. Some people sleep very little or not at all, yet may not appear tired. There can be dramatic mood swings, from feeling energetic or unusually happy to suddenly becoming frightened, angry, depressed, or tearful. Speech and behavior may become disorganized. Perhaps most importantly, a person may begin losing the ability to distinguish reality from thoughts, fears, hallucinations, or delusions. Unusual beliefs involving the baby can also occur. In the most severe cases, thoughts involving suicide or harm to the baby may develop. It's important to remember that postpartum psychosis is a medical emergency requiring immediate professional treatment. One of the most discussed aspects of the Lindsay Clancy case is her medication history. According to the information summarized in this presentation, she received more than 30 prescriptions involving 13 different psychiatric medications in the months before her children's deaths. The medications included drugs such as Zoloft, Ativan, Valium, Seroquel, Lamictal, Remeron, and Trazodone. These medications belong to very different drug classes. Some are antidepressants, others are anti-anxiety medications, antipsychotics, sleep medications, or mood stabilizers. The number of prescriptions has received considerable attention, but that number by itself does not tell us whether the medications caused her mental condition or the events that followed. That is one of the issues being disputed. According to the forensic toxicology testimony summarized in this presentation, several psychiatric medications were identified in Lindsay's system after the incident. Those medications included mirtazapine, commonly known as Remeron, lamotrigine, known as Lamictal, trazodone, and quetiapine, commonly known as Seroquel. Each of these medications works differently and may be prescribed for different psychiatric symptoms. An important distinction throughout this discussion is that simply finding a medication in someone's system does not prove that it caused a particular behavior. The defense and prosecution may interpret Clancy's medication history differently. Understanding what these medications generally do can therefore help us better understand the arguments being presented to the jury. Postpartum psychosis generally requires prompt medical treatment. Hospitalization may be recommended, especially when someone is experiencing severe confusion, hallucinations, delusions, mania, suicidal thoughts, or concerns about the safety of the mother or baby. Antipsychotic medications may be used to reduce hallucinations, delusions, paranoia, agitation, and disorganized thinking. Mood stabilizers may also be important, particularly when symptoms involve mania or bipolar disorder. Lithium, for example, has been studied extensively in connection with bipolar illness and postpartum psychosis. Benzodiazepines may sometimes be used on a temporary basis to control severe anxiety, agitation, or insomnia. Treatment must always be individualized by qualified medical professionals. Medication is only one part of treatment. Restoring healthy sleep can be extremely important because severe sleep disruption may worsen psychiatric symptoms. Another treatment sometimes used in serious cases is electroconvulsive therapy, commonly called ECT. ECT can act relatively quickly and may be considered for severe depression, mania, catatonia, suicidality, or symptoms that aren't responding adequately to medication. After the immediate psychiatric crisis is controlled, psychological support and family education can become important parts of recovery. Long-term psychiatric follow-up is also recommended because individuals who experience postpartum psychosis may have an increased risk of future mood or psychotic episodes. So treatment is usually much broader than simply prescribing medication. Now let's look at some of the medication categories involved in this case. SSRIs, or selective serotonin reuptake inhibitors, are commonly prescribed antidepressants. It works by increasing the amount of a chemical called serotonin in your brain, which helps nerve cells talk to each other and improves your mood. Unlike other classes of antidepressants, SSRIs have little effect on other neurotransmitters, such as dopamine or norepinephrine. They affect serotonin activity in the brain and are frequently used for depression and anxiety disorders. Unlike a medication that works immediately, SSR is often requires several weeks before their full therapeutic effect is reached. Common examples include Prozac, Zoloft, Lexapro, Celexa, Paxil, and Luvox. Possible side effects may include nausea, sleep disturbance, headaches, restlessness, tremors, and sometimes a feeling of emotional numbness. Zoloft is particularly relevant to this case because Clancy was prescribed it during the months leading up to the deaths of her children. Benzodiazepines are another category of medication appearing in Clancy's treatment history. These medications slow activity in the brain and nervous system. Benzodiazepines work by binding to a specific site on the GABA A receptor in the central nervous system. This action boosts the natural calming effects of the neurotransmitter GABA, which lets more chloride ions into nerve cells and slows down brain activity. One way to think about them is to imagine the brain chemical called GABA as a kind of brake pedal. Benzodiazepines strengthen GABA's calming effect. As a result, anxiety may decrease, muscles may relax, and sleepiness may increase. These medications can be helpful for severe anxiety, agitation, insomnia, and certain other conditions. Examples include Xanax, Ativan, Klonopin, Valium, and Restoril. In Clancy's case, both Ativan and Valium appear in the medication history summarized in this presentation. Like all psychiatric medications, benzodiazepines have benefits and risks that depend on the individual patient. Another important medication category is second generation, or atypical, antipsychotics. They works by interacting with multiple neurotransmitters in the brain, primarily blocking dopamine and serotonin receptors to help regulate mood, thoughts, and behavior. Atypical second-generation antipsychotics work primarily by blocking both serotonin 5-HT2A and dopamine D2 receptors. Unlike older typical drugs, they bind loosely to D2 receptors and dissociate quickly, reducing movement side effects. Some agents also act as partial dopamine agonists. They're used for conditions including schizophrenia and bipolar disorder, and sometimes severe depression or other psychiatric disorders. They may help reduce hallucinations, delusions, agitation, and disorganized thinking. Examples include Seroquel, Risperdal, Zyprexa, Abilify, Geodon, Latuda, Clozaril, and Vraylar. Seroquel, also called quetiapine, is particularly relevant in this case. Clancy was prescribed Seroquel during the period when she was reportedly experiencing significant psychiatric symptoms. The defense and prosecution may differ sharply over what Clancy's treatment history tells us about her condition. Two other medications deserve individual attention. Remeron or mirtazapine is an antidepressant used primarily to treat major depressive disorder. It affects norepinephrine and serotonin signaling and can cause sleepiness, increased appetite, weight gain, dry mouth, and dizziness. Lamictal or lamotrigine is quite different. It was originally developed as an anti-seizure medication, but is also widely used as a mood stabilizer, particularly in bipolar disorder. It affects electrical activity and certain neurotransmitters in the brain. Possible side effects include dizziness, headaches, vision problems, nausea, sleepiness, and coordination difficulties. Both medications were part of the treatment history discussed in this case. Now let's walk through the medication timeline. On September 12, 2022, Zoloft was prescribed for postpartum anxiety and depression. By mid-October, Clancy had begun taking the medication, and the dose was reportedly increased from 25 to 50 milligrams. On October 20th, she reportedly experienced severe insomnia, worsening anxiety, and racing thoughts. Zoloft was discontinued, and Ativan and Benadryl were prescribed. On November 16th, she went to an emergency room because of insomnia and was prescribed trazodone. Several days later, on November 21st, Prozac was prescribed. This timeline illustrates how quickly her treatment plan was changing. The medication changes continued. On November 25th, Prozac was reportedly discontinued after only several days because her symptoms had worsened. Ambien, Remeron, and Klonopin were then prescribed. On November 29th, another psychiatric provider evaluated Clancy and prescribed Seroquel. The presentation states that between November 30th and December 6th, there were reports of worsening suicidal thoughts. On December 6th, Valium was prescribed. During December, Lamictal was also added while treatment continued for depression, anxiety, insomnia, and suicidal thoughts. By this point, Clancy had experienced numerous medication changes within a relatively short period of time. The timeline continues into the final weeks before the children's deaths. In late December, according to the presentation, Women's and Infants Hospital reportedly recommended reducing or discontinuing Seroquel because some symptoms might have been medication-related. On December 31st, Clancy was admitted to McLean Hospital for severe depression and suicidal ideation. Her medications were reviewed and adjusted. During January, she continued taking several psychiatric medications. On January 23rd, the day before the children's deaths, Clancy attended another psychiatric appointment. Court filings referenced in the presentation indicate that her amitriptyline dose was increased. The following day, January 24th, her 3 children died. Because several medications were being used at the same time, another issue is their possible combined effects. The presentation identifies sedation as one practical concern involving Remeron, trazodone, and Seroquel. All 3 medications may cause sleepiness. When medications with sedating effects are combined, those effects can sometimes add together. A person might experience slowed thinking, dizziness, impaired coordination, or difficulty functioning normally. Trazodone and Seroquel may also lower blood pressure when someone stands up, potentially causing dizziness or fainting. The presentation also discusses serotonin syndrome. However, it describes that condition as uncommon with this particular combination. These general medication effects do not establish what happened in Clancy's individual case. Lamictal has a somewhat different safety profile. It may cause dizziness or sleepiness, but one of its most widely recognized serious risks involves skin reactions. A new rash after starting lamotrigine requires medical attention because, in rare cases, serious skin reactions can develop. The risk is especially important when a patient first begins the medication or when the dose is being increased. This is another reminder that psychiatric medications can have very different effects and safety concerns. It also shows why medical supervision and careful monitoring are so important when medications are being started, stopped, or adjusted. Again, none of these general risks alone tell us what Clancy's mental state actually was on January 24th. Seeing several psychiatric medications prescribed at the same time can understandably raise questions, but there can be legitimate medical reasons for using more than one medication. Different medications may target different symptoms. For example, Lamictal might be used for mood stabilization. Remeron may be prescribed for depression and may also affect sleep. Trazodone is often used for depression or insomnia. Seroquel may be used for bipolar symptoms, depression, psychosis, agitation, or sleep, depending on the circumstances. What we cannot determine simply from a medication list is why each doctor made each decision. That requires looking at medical records, clinical evaluations, symptoms, dosages, timing, and the patient's response. The trial involves much more than psychiatric medication. Jurors have heard Patrick Clancy's 911 call from the night he discovered the children. Medical professionals have testified about the attempts to save them and their causes of death. Jurors have also visited the family's former home in Duxbury and other relevant locations. The case includes forensic evidence, medical records, psychiatric evaluations, testimony from treatment providers, and Lindsay Clancy's own journal entries. Each piece of evidence may tell the jury something different. Some evidence relates to what physically happened. Other evidence may help jurors evaluate whether Clancy was experiencing psychosis or another severe psychiatric condition. Ultimately, the jury must consider all of that evidence together. The Lindsay Clancy case has attracted national attention because it raises extremely difficult questions involving mental illness, motherhood, medicine, and criminal responsibility. Postpartum mental health disorders are real medical conditions. At the same time, the deaths of 3 children require a criminal justice system to determine responsibility. Those two realities exist at the same time. The case therefore raises questions that go far beyond one family. How should the law evaluate severe mental illness? How should postpartum psychiatric symptoms be recognized and treated? And when does mental illness legally prevent someone from being held criminally responsible? Those questions are part of what makes this case so complicated and emotionally difficult. After reviewing all of this information, there are several important questions worth considering. What evidence most strongly supports the defense claim that Lindsay Clancy was suffering from postpartum psychosis? What evidence most strongly challenges that claim? How much weight should be placed on the number of psychiatric medications she was prescribed? Do those medications help explain her deteriorating condition, or are they simply evidence that doctors were trying to treat severe symptoms that already existed? Which pieces of evidence tell us the most about Clancy's mental state specifically on January 24, 2023? And finally, which statements in this case are established by evidence and which remain interpretation, argument, or speculation? Those distinctions matter. As we close, I want to emphasize something important. This presentation discusses a pending criminal case involving the deaths of 3 children, severe mental health allegations, psychiatric medications, and competing legal arguments. Some information comes from testimony, court filings, medical evidence, and publicly discussed records. An allegation is not the same thing as a proven fact. A medical diagnosis also cannot be made simply by reviewing news coverage or a list of medications. Lindsay Clancy has pleaded not guilty by reason of insanity, and the ultimate legal conclusions belong to the court and jury. The purpose of this discussion was to review the medications prescribed to Lindsay Clancy, the medication classifications and their action on the brain, and potential side effects. Thank you for watching, and as always, keep searching for the truth while shutting out the noise. Please like, subscribe, and hit the notification all button.